We call it by the acronym for left ventricular assist device, which is the short term is LVAD.
Okay, so
and LVAD basically...
Go ahead.
It's basically a pump that takes over the function of the heart itself when a patient gets into a condition known as end-stage heart failure. That means that the heart pumping function is no longer capable of supporting the work the heart normally does.
So this thing is doing all of the work for him, and he is not eligible, is that correct, for a transplant? So that's one reason that he has this device?
Well, that's not exactly true. And most centers that do heart transplants will not perform heart transplants in patients over the age of 65, but a few specialized centers around the country will perform heart transplants under certain conditions up until the age of 72.
Okay, here's what I found interesting is that this thing is connected to either you have to plug it in or there is a battery that has to be used in order for this to work. So in order for him to survive, he has to be powered, so to speak.
Exactly. It's really a device that's run by an external battery pack, and there's a wire that basically goes into the body that runs a pump that's planted inside the body, and that pump is taking blood that enters the heart, and it pumps it into the aorta so that the blood is pumped to the rest of the body, and the heart is basically in a complete resting state while this pump has taken over complete functioning of the heart.
First few days with this are critical. It is very painful, and people can, because of complications, people can die if this doesn't work.
Definitely. There are a number of complications that can result from LVAD placement. One of the most serious complications is the risk of stroke because blood clots can form within the pump or within the vessels that are leading to the aorta and from the heart, and those clots can travel to the brain. And therefore, stroke is one of the biggest and most major complications. Other complications also include possible infection, and patients can also undergo multiple organ failure, such as kidney failure and respiratory failure.
So, doctor, I mean, you're saying it in so many words, but I mean, just tell me, what does this say about the former vice president's health, the health of his heart, at least?
Well, he is in a serious condition known as congestive heart failure, and this is pretty much end-stage congestive heart failure, such that he would not be able to survive very long without the use of the pump or without a heart transplant.
Yeah, and it's
and these pumps are now very effective in prolonging people's lives, and the latest generation pumps have been shown to prolong survival for quite a bit. In fact, more than half the people that receive pumps live for more than 2 years with the pump itself.
It's not cheap, and we're talking about just the device, $100,000.
Exactly. It's not cheap at all.
Yeah. All right. Thank you, Dr. Chaudhry, from the New York cardiologist from Mount Sinai Hospital. We appreciate it. We're going to talk politics next on CNN.